welcome. Take a seat. Thank you for moving down so you can, I feel like you're all included. Look, I'm going to speak to you about out-of-pocket expenses among families with rare diseases, and of course tuberous sclerosis is a rare disorder. So, where's my thing? Just to let you know where I'm from the University of Sydney and the Australian Paediatric Surveillance Unit. We're a national unit that conducts research in rare childhood conditions. We're national, so we collect a lot of epidemiological data in rare conditions. We also do quite a bit of health services research, so we're wanting to improve health services for your children. And in order to do that, we need to do some research to provide some evidence to health service planners to actually improve things. So I don't know how many of you know, but everyone keeps talking about universal coverage in Australia for health. That isn't really so. We have a blended system of financing in Australia. So there's public funding, there's private health insurance, and quite a bit is actually covered by families themselves. So it's money out of your own pocket. So according to the Australian Institute of Health and Welfare, AIHW, about 24.3 million of health spending in Australia comes directly from people's own pockets. It's estimated to be about $1,000 per person per annum, and the average household spends about 3% of their household budget in out-of-pocket expenses. And that's twice as much as in the UK. Or New Zealand, and it's the 5th highest in the OECD. So no, we don't have universal coverage. Not everything is covered by the public system nor by private health insurance. So this is an average for the nation, but really what we're interested in is, well, how much are people with rare diseases spending? So a couple of years ago we conducted a survey supported by the Australian Research Council, and it was a fairly comprehensive survey looking at a number of issues, but one of the things that we did look at was out-of-pocket expenses. And the survey was completed by 462 families, and we didn't care what rare disease they had, because families who have a child with a rare disease face the same issues no matter what the disease is. So there were about 200 rare diseases represented amongst those 462 families. So the data we got was that families were spending quite a bit of money out of pocket, and they were spending this money on transport, getting to health services. Often rare diseases are looked after in large metropolitan centres, in big children's hospitals, and so if you live in the country, you're spending a lot of money on transport. They were spending money on medical equipment, on medications, on health services, and yes, not all health services are covered. Even GPs charge a fee on top of the usual schedule, and there was a various other funds spent. What we didn't get in that survey, because it was a very large, all-encompassing survey, was the detail. So really, when we talk about transport, what transport? What equipment? What medication? And we actually asked people to recollect retrospectively over the last 12 months what they collected. So there are limitations to these data. Hence why we're very keen to do a study prospectively, so looking at out-of-pocket health-related expenses on a month-to-month basis. So we're very lucky to have been able to collaborate with Tuberous Sclerosis Australia and the Australian Mitochondrial Disorders Foundation, who gave us some start-up funding to develop and pilot a study. So initially we're doing it in these 2 disorder groups, but we want to develop the survey so that it's applicable to other rare diseases as well. So we're not, doing this over and over again. We have a tool that can be applied across the board. So this is where we're at. We've got the funding agreement, fantastic. We've developed a survey, which involved researchers, families from both TSA and AMDF, and key clinicians expert in these two disorder groups. The survey has been programmed into an online system and will be available for you to complete online. We've developed a participant information, consent and recruitment flyer, and we've submitted everything to ethics, and we're just waiting for the final letter to come, which is likely to come next week, because they have reviewed it and there were some very, very minor problems that we need to adjust, and we're kind of, does this point? Where? There? No? Okay, we're at the recruitment phase almost. So this is really timely because we would love you to participate in this survey. Then, after we collect some data, well, what do we do with it? Analysis, writing up, publication, and most importantly, advocacy for change. What do we want to change? Well, if you look at the MBS, it's a very convoluted and not very smart system, I must say. So if you look at the provision of autism, pervasive developmental disorder, or disability services provided by allied health professionals, so that's OTs, physios, speech therapists, psychologists, social workers, they have this list of disorders here, which, it lists about 10 or 12 disorders. But there are approximately 8,000 rare disorders. So this essentially excludes a lot of families from accessing these services. There are also age limits. So in order to access, an OT for assessment, your child has to be less than 13 years. And in order to access an OT for therapy, they have to be less than 15 years. Well, what happens after 15 years? They don't get better. They still have needs and they still need these services. So we're hoping to gather some data to actually provide to the MBS review, which is happening at the moment. So they are reviewing all the MBS items. So that's another reason for actually participating in this study, to get some of that evidence. So what do we mean by out-of-pocket health expenses in the context of our research study? It's pretty much any expense related to your child's health condition and not covered by Medicare, not covered by private health insurance or any other scheme. So it's literally money coming out of your pocket. And we've taken a fairly broad view, so we're including visits to health professionals, including GPs, allied health, dentists. We're looking at medications not funded by the PBS, and not necessarily medications that need to be prescribed, because for a lot of rare disorders, people need supplements, they need special foods, all kinds of different things that are not necessarily prescribed. We're looking at consumables, so masks, tubing, gloves, some people need nappies for years for their child, dressings, etc. Essential equipment such as walkers, wheelchairs, special prams, infusion pumps, ventilators, and so on. The costs associated with hospital admissions, travel costs such as parking, overnight accommodation when you're going to the hospital with your child, house modifications if you need ramps or bathroom modifications, and special education programs. So we've taken a fairly broad view of health-related expenses. So who can participate? Any family who has a young child or a young person aged less than 22 years and diagnosed with tuberous sclerosis or a mitochondrial disorder. You need to have adequate command of English to complete this survey. And what will I have to do? Well, you will have to, if you're interested, we will send you an information pack, which will include all of the information that you need, and we'll also give you a web link to the survey. So you complete the survey online. If you wish, we can provide the survey as a paper form, but I think most people will probably choose the online version. And what we really want is to collect quite accurate data over 6 months. So there will be an initial survey, which will take about 30 minutes, where we ask you about your financial situation, you know, income bracket, how many people in the household work, whether you have private health insurance, whether you own your own home, that kind of thing. And then there will be 6 monthly survey where we would really like you to keep records of all your out-of-pocket expenses. And each month we'll send you a survey, a new link to a survey, and you enter those expenses into the system. And each month we will be able to provide your own data back to you, so you have a record of what you've provided and what you've spent out of pocket. And then at the end there's an evaluation survey which takes about 15 minutes. So it's quite a commitment for busy families, but we feel it's a really important study to undertake to actually change health services and the way that they're funded. So in terms of privacy and data security, of course participation is voluntary. Data will be stored on a secure server at the University of Sydney, and your details, name, email address, will be held separately from the details about your finances. So the details that you provide about your finances and what you've spent are completely de-identified. You may withdraw from the study at any time, even after you have completed the survey, because we'll be able to go back to our list and re-identify who you are and remove that data. So if you really want that to come out, we're happy to do that. And we've got, the ethics has been set up to take that into account. So individual children or families will not be identified in any way in any reports or publications, and only aggregated results will be provided to health service planners. In the survey we do ask for your child's first name. That's mainly because some families have more than one child affected by a condition, and so just to keep track of who's who and for whom the expenses were spent, we've asked you to do that, but that will be taken out once the study's finished. So the survey looks like this. Most of it is, clicking onto the little circles. There are very few short answer questions, and there are some questions where you need to put amounts in dollars. We're not asking for exact income, just the income bracket, and some general questions about your financial situation. So, if you're interested, it'd be really great if you registered your interest, and I will leave these forms at the front desk, and Claire will collect them. I won't take them because we don't have the final letter from the Ethics Committee, so I'm not allowed to take them, but I'll leave these there and Claire will keep them until we do have the final letter of approval from Ethics. If you have any questions, please ask them now or later. I'm happy to be contacted on that number there, or you can have a chat with Claire and she can refer you to us if you wish. All right, well, I hope you decide to participate. Thank you.